Hello, good evening, everyone. Myself, Dr. Shakthikumar C, nephrologist, consultant nephrologist from Lotus Hospital and Research Center, Erode, Tamil Nadu. Today, we are going to discuss about the well-known topic that is edema. Awareness of about edema. What is edema? Edema is nothing but the accumulation of abnormal fluid under the tissues. It can be under the skin or any other organ like uh, lungs, brain. As we name organ, the edema can be named. So if it accumulates under the skin of the leg, it can be called as pedal edema. If it is accumulates in excessive in the lungs, it is called as pulmonary edema. If it accumulates excessively in the brain, it is called cerebral edema. So what are the causes of edema? So edema can be due to many causes. So first we'll discuss about the physiological causes of edema. Physiology means without any reason the edema can come. That is, without any disease per se, the edema can occur in the human body. So, what are the conditions? First and foremost, when we sit in one place for prolonged duration, or we stand in one place in a prolonged duration, the edema can occur due to accumulation of fluid in the lower part of the legs, mainly in the ankle region or legs. So that can be a physiological reason. Second one is pregnancy. In pregnancy, there will be so many hormonal variations. So like progesterone will increase, and in some conditions, blood pressure will increase. In those conditions, the patients might get leg edema, pedal edema. So other conditions, when we take the water excessively without any need, so it can cause edema. These are the most important cause of physiological edema. So secondly, pathological edema. What is pathological edema? So when a person get disease, the edema will occur. So what are the conditions? So mainly there are 3 to 4 conditions. So first condition, mainly it can be due to a kidney disease. So usually in the kidney disease, there will be 5 stages. The first 1 or 2 stages, the kidney function will be in first stage, there will be 90% functioning of kidney. In the second stage, there will be 60 to 90% functioning of the kidney. So in those stages, edema won't occur in few patients. So as the kidney disease progress, and the kidney stages are around 3 to 5 like that, or in the patients with dialysis, the pedal edema, that is leg edema is very common. That is one condition. Secondly, in cases of heart disease, in patients with severe heart disease, the heart pumping capacity will decrease. That will cause accumulation of fluid in the abnormal accumulation of fluid in the body. That will cause pedal edema. Thirdly, liver disease. Why in liver disease? The liver disease, there will be decreased production of protein, mainly albumin. So if there is no albumin in the blood, so it will cause extravasation of fluid into the tissues, accumulation of fluid in the tissues. So it results in leg edema, periorbital edema, abdominal wall edema, everything. So this is the third condition. Fourth condition, in case of hypothyroidism, the thyroid dysfunction. In case of severe hypothyroidism or severe hyperthyroidism, thyroid function if decrease or increase much means so edema can occur. Fifthly, if there is any decrease in hemoglobin, if our blood count suddenly drops due to various causes, that can cause heart dysfunction and it lead to edema of both legs and other regions. So these are the important causes of edema. These are disease conditions. So other medicines also can cause edema, such as vasodilatory medications, such as calcium channel blockers, such as amlong, nifedipine, like that. So some diabetic medications like pioglitazone can cause edema. So any other chemotherapy drugs, so many drugs can cause side effects of, and due to side effects, it can cause edema. So these conditions also we should keep in mind. Few patients with uncontrolled hypertension and uncontrolled diabetes, so that can lead to kidney disease. Those patients can present with pedal edema. So these are the pathological causes of edema. So few other conditions like excessive salt intake. Salt means the table salt. It has uh, sodium, high sodium. Whatever the food which contains high sodium or processed food we are having in day-to-day life, that can result excessive consumption of those things can result in water retention on our body and it can cause fetal edema. So these are the few conditions we should keep in mind before evaluating the patients. Any patient come to us with fetal edema. So further going to the topic. So whenever a patient comes to you, what are the investigations we should do before going for treatment? So first, basically, we should do complete blood count. So in that, we should check out whether the hemoglobin is normal or high, like that and all. And renal function test, kidney function test, urea creatinine we should do, and electrolytes like sodium, potassium, bicarbonate, everything we should do, and simple urine test. Why urine test? So if the patient's renal function is normal, but there is abnormal excretion of protein in the urine in few conditions. So that can cause severe hypoalbuminemia in the blood that can cause fetal edema. So we should do these four basic tests before we should treat the patient. Also, we should evaluate the cardiac status of the patient. If all the test is normal, still patient is getting fetal edema means we should do cardiac evaluation. It is heart to evaluate for heart disease. So we should refer to cardiologist to do ECG and echo. So what are the symptoms? The patient's present with fetal edema. What are the other associated symptoms patients can have? He can have shortness of breath during walking or even during rest. He can have symptoms. So some patients due to high BP, he can get headache, dizziness like that, vomiting, nausea, everything. So if the patient has got kidney disease, liver disease like that, he can present with abdominal distension, facial puffiness, so on. So some patients will get decreased urine output. Urine won't be, they won't be going properly. So these are the symptoms we should ask the patient if the patient has fetal edema. So other things, after evaluating all these things, we should come to the treatment part. So first and foremost in the treatment part, so we should treat the cause of edema. If the patient got kidney disease, we should treat the kidney disease. If the patient got liver disease or heart disease, we should treat accordingly. If the patient is having thyroid hypothyroidism, so we should treat with thyroxine hormone supplements. So whatever the cause of edema, if we treat the edema will decrease. So other than this, we can use diuretics. So diuretics, what it causes, it will cause excretion of free water through the kidney. So that is the main work of diuretics. So diuretics, short acting, long acting, either diuretics, loop diuretics, everything is there. So loop diuretics is the best thing in the initial management of edema that we can use according to the patient's body weight and patient's tolerance. Initially, we can't use high dose. So initially, we should start with low dose and we can hike up the dose gradually. So these things you should keep in mind. So other than that, what else? Even if after treatment with diuretics, some people will get edema. Will have persistent low or mild edema. In those patients, we can advise stockings, leg stockings. We can advise. So those stockings, some patients will get irritation or discomfort. So we should educate and counsel the patient accordingly to avoid those discomfort. Thirdly, whenever a patient comes with edema, not only medications, we should advise diet advice. So the main diet advice is salt restriction. So whatever patient edema, salt restriction is advised. How much salt restriction? The patient takes salt normally. There is severe pill edema means at least we should tell the patient to temporarily avoid salt in whatever food he consume for few days till the edema subsides. Or if there is mild edema, we can advise off salt diet or less than 2 grams salt diet like that. So without salt restriction, edema won't come down. So that is very important. Also, water restriction. We advise if there is severe peat edema means less than 750 ml to 1 liter per day like that water. So mild to moderate peat edema means up to 1.5 liters water he can take. So depending on the medications and patent status, we can advise water restriction. Thirdly, treatment of disease. As I told, if the patient has got kidney disease, liver disease, heart disease, we should treat the patient accordingly. So whatever the cause of edema, first before taking medications, you should consult your doctor nearby or in a or a specialist referred to. So uh, thank you. Good evening. Hope my talk you understood well. Any doubts you can ask. Thank you.